We will talk about rabies. Rabies is 100% preventable disease, but if symptoms develops, it's 100% lethal. So you should prevent rabies from developing, and it's 100% preventable. Rabies is viral infection. This viral infection spreads via dogs, usually dog bite, and it causes brain inflammation, and it affects central nervous system. It causes inflammation, causes damage of cells, and this damaging is irreversible, and person will die due to encephalitis. Encephalitis is inflammation of the brain. More than 90% of cases of rabies is caused by dog bite. So dog bite is responsible on more than 90% of cases in the world. Scratches, abrasions, and via eye drops, it's possible theoretically, but in practice it's very rare. Most cases it is caused by bite, not scratch, not abrasions. Very little chance that it can spread via scratch, but almost 0% is chance. Also, it can spread by being in cage with pets, but almost 0% of chance. Dog is most commonly source of rabies. In the world, dog bite is 99% of cases. So dog bite is most common cause of spreading of rabies. Other cases are on bats, bat bite, especially in USA, and raccoons also, but dog bite is most common cause of rabies. Now let's say what is symptoms, what is incubation period. Incubation period is, for example, from dog bite to first symptoms. Incubation period is 1 to 3 months, usually, sometimes more, sometimes less. In very little cases and very few cases, it can develop symptoms in 7 days, sometimes after several years, but very rare cases. Usually it's 1 to 3 months. And it is dependent on proximity of bite to the brain. So how short is distance from bite to the brain? For example, if leg is bitten, then it requires much more time compared to face. So proximity of the bite site is very important. Now let's say what is symptoms when symptoms develop. As we said, when symptoms develop, it's already too late. And initial symptoms is fever, headache, and weakness. What it means? It means that this virus travels through the body via nerves. It travels alongside nerves and eventually reach to brain. So when symptoms develop, it means that this virus already reached to the brain. That's why we have symptoms. And it causes fever, headache, and weakness. It lasts around 1 week. These symptoms last for several days, around 1 week. After this, we have another stage. This fever stage is initial stage, and second stage is acute neurological pace. This acute neurological pace is very important because after this we already have death. And symptoms of acute neurological pace is insomnia, anxiety, confusion, partial paralysis, hallucinations, and hydrophobia, fear of water. So people with rabies, they have hydrophobia, fear of water, and they have hallucinations, confusion, they can be aggressive. So it's acute neurological pain. It means that brain cells already damaged importantly. And once this symptom starts, even once this initial symptom starts, even fever, headache, weakness, it's already end. There is almost no cases cure from these stages. That's why we should prioritize maximally to prevent this disease. And what is our action plan? If person is bitten by a dog or mammals, and if we have some suspicion that this animal is infected with rabies, we need post-exposure prophylaxis, which is called PEP. Post-exposure prophylaxis, what it means. And rabies immunoglobulin should be injected to infiltrate the bite area as much as possible. It's very important to fight against these viruses on the bitten area or around wound. It's very important, immunoglobulins. Second, what we do, it's vaccination. Vaccination includes 4 doses, typically on the days 0, days 3rd, and days 7 and days 14. So we need 4 times vaccination. So first injection is on the site. It's immunoglobulin. It's not vaccine, it's immunoglobulin. Actually it's a form of vaccination also, because it's passive. We inject passive immunity, but classical vaccination is 4 doses on the day of 0, 3rd, and 7 and 14. Now, here is many questions that, for example, if I am previously vaccinated, if you are previously vaccinated, maybe 2 doses is enough. In many cases, 2 doses vaccine is enough. Wound care is important immediately after animal bite, and wound care means washing this wound with water and soap. Another question is if single dose of vaccine is enough. No, single dose of vaccine is not enough, because it's not considered enough, it's not considered sufficient dosage. That's why it's not enough. And what means pre-exposure prophylaxis? For example, if you're going somewhere and you fear that you will have contact with animals and you have no time for observe them, and you want to be prepared, you want to be protected, then vaccination is possible. It is called pre-exposure prophylaxis, which means 2 dosage of vaccines, usually 1st day and 7th day, and after these 2 doses you are protected around 2 years. Also, here's question: if I'm vaccinated, if I'm fully vaccinated, how long I'm protected? You are protected around 2 years also. So if you are fully vaccinated, you are protected around 2 years. And also there is question about alcohol and vaccination, because there is some misconception about alcohol intake. They're saying that alcohol consumption is not allowed after vaccination for 6 months. It's not true. Of course, moderation is important, but there is no evidence which says that alcohol is prohibited. It's not true. But of course, if person intakes high amount of alcohol, it weakens immune system, and if this person has rabies, of course it will affect effectiveness of vaccination. But usually in moderation, it has no connection with vaccination. And 10 days rule. What is 10 days rule? For example, if person is bitten by puppy, for example, and this puppy is well, puppy is healthy, you can observe this puppy for 10 days. After 10 days, if this puppy is still happy, is still well, then it means that with almost 100% of probability this person has no rabies. Why? Because when when animal has rabies and when animal can spread rabies via saliva, then this animal already will have symptoms very soon. So if within 10 days animal is well, there is very low probability that this animal has rabies. It's very important point. So you can observe animal. For example, I was bitten by dog. I'm observing this animal. If this dog is home dog and if I know that he's happy dog and not ill, and just we were playing and he accidentally bite me, I can observe for 10 days. If dog is well, no need worry. But if dog is ill, of course, immediate treatment required, and of course we need immediate vaccination even if we are bitten by, for example, unknown dog, unknown animal, and it's not our home dog. We need vaccination and we need to observe this animal. But if this dog is our dog, or if our dog is vaccinated also, then we just wait and watching for 10 days. If this dog is well and no problem, then no need to worry. That's the main principle of rabies. I hope it will be helpful for you. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.